Hello, everyone, and welcome to Wellness Wednesdays. My name is Jamie Neal, Advanced Practice Registered Nurse and Certified Nurse Midwife here at Lifetree Women Care. We're going to talk today about common discomforts associated with pregnancy and the warning signs. When should you seek medical attention? So during the first trimester, especially in the beginning, a lot of women may experience some nausea and vomiting, and a lot of people call that morning sickness. And a little bit of that is okay and not to panic. And sometimes people think it's a good thing. However, if you're throwing up so much that you're not able to hold down even water for more than 24 hours, that at that time you need to call the doctor's office or your OB office and make an appointment. And if you're getting so dehydrated and nauseous so bad that it's making you have a headache and weakness or shakiness, you might want to go ahead and go to the emergency room in order to get some treatment like IV fluids and medication that will work for you. Other symptoms in the first trimester sometimes can include heartburn, and heartburn is a common side effect of pregnancy, especially as your uterus begins to grow and get bigger because it's squishing your stomach a little bit. And so you have to eat smaller and frequent meals versus a larger meal. And some people also need to avoid tomato-based recipes, anything acidic like citrus fruits, things like that, spicy foods you might want to avoid if you see that you're having heartburn. You can take something over the counter for that, like Tums. And I just encourage people to make sure that you don't lie down right after you eat. So if you eat, you want to stay upright for a while, at least an hour or two before you lie down to go to bed or whatever like that. Other signs and symptoms include constipation. Sometimes women get constipated in pregnancy. The hormonal changes during pregnancy can cause some of these symptoms to happen. And to avoid the constipation, make sure you're drinking plenty of water. At least 8 bottles of water a day will help keep your gut moving. Eat fruits and vegetables and stay away from junk food because that's not good for you. It doesn't give nutrition to your baby, and it can probably make constipation worse. You can use Miralax or milk of magnesia if it's in a situation where you really need to go and you're having difficulty. But if you haven't had a bowel movement in more than 7 days, then you need to contact your provider so that we can help you in that situation. And as the pregnancy progresses into the second trimester, between 18 and 22 weeks, it starts to become fun because you will feel quickening or you'll feel movement or flutters from the baby. And that's the fun part. And soon after that, your uterus begins to grow even bigger and make less room in your body for other organs, and stretching on ligaments and muscles may cause some small aches and pains. And we call these things round ligament pain because the ligaments in your hips and your back around your abdomen are stretching. So the way to avoid those pains, they sometimes feel very sharp with sudden movement. So with those kinds of pains, to avoid them, you just get up slower or sit down slower. Don't move too suddenly, and it will help to avoid that. And the pains are normal because it's just the stretching of your ligaments, and that's why it feels the way that it does, sharp. And if your baby is basically suspended in your abdomen, and if you move too quickly, the baby is jolting around, and that's why you're having that pain. So just move a little bit slower. If though your pain, sometimes it'll go up your back or down your hip or down your leg, that is called some sciatic back pain or sciatic nerve pain. And that's just weight because the baby is pressing on a nerve, causing that sharp pain down your back or up your back or down your leg. And Again, some stretching can help with that. So don't move suddenly. Staying hydrated and well nutrition, and resting when you need to, will help with that. And speaking of pain, when you get closer to the end of the pregnancy, when it's almost time to deliver, your body will begin to practice and start having little mild contractions. And that's to get your cervix ready for labor. A few contractions here and there throughout the days as you get closer to delivery is normal. But if you're having more than 7 contractions in an hour, I would suggest you drink 2 full bottles of water, rest for a little while, maybe 30 minutes to an hour. If your contractions begin to get stronger, and no matter if you drink the water and you're lying down with your feet up resting, the contractions seem to be getting stronger and worse and closer together, that's when you want to call your provider. It might be time to go to the hospital. It might not, but that is the time you want to call. And anytime that you're having contractions that's more than 7 times an hour, that's strong and very painful, you can always visit the emergency room or the triage where your delivering provider has privileges, where they tell you to go, and you go there so they can evaluate you to see if you're in labor. A lot of times I like to end all of my appointments with warning signs to seek medical attention. Those warning signs include, for all pregnant women, any vaginal bleeding, especially if it's enough bleeding that you have to wear a panty liner or a pad, you need to call your provider. If you're having severe pain, whether that be cramping pain, sharp pain, is severe pain and it's hindering your daily activities, you need to call your provider for that. Anytime, especially at the end of your pregnancy, when you feel that your water is broken or you feel a water coming out, you have to call your doctor and go to the hospital right away if your water breaks. And after the 22 weeks, you should feel movement from your baby every single day. If you're not feeling movement from your baby after 22 weeks, you can drink some ice cold water. And if your baby doesn't move within a few minutes, then you should go to the emergency room and see or call your doctor or your midwife. So the 4 warning signs to remember are vaginal bleeding, leaking fluid, your baby is not moving, or severe pain. Those 4, in a nutshell, are the main 4 warning signs for pregnant women to seek medical attention right away. Well, you guys, I'm so glad you were able to join me this time on Wellness Wednesday. We were talking about normal discomforts of pregnancy versus warning signs and seeking medical attention. Glad you guys could join me. I hope you will join me again next week for Wellness Wednesday here at Lifetree Women Care, and we'll see you again soon. Thanks, guys. Bye.